Welcome everybody to Top in Tech. This is a series of discussions we've had as how technology and technology companies is responding to the changes in Malaysia and with COVID-19. Top in Tech is jointly organized by Digital News Asia, Scale Up Malaysia, Malaysia Kini, and KiniEvents. It's an online forum where we introduce to you personalities, people, and technologies to have a better understanding of the transformations and innovations that we're having during COVID-19. Particularly today, digital technologies have converged with living and societies, in terms of changing, and especially how we deliver the efficiency of healthcare. We have a lot more virtual consultations. Is remote care is increasingly being accepted, and now we're enabling like clinical services to happen without people actually having a visit to clinics. Before COVID, some healthcare providers dabbled in this, but now we see a much more interest in this new trend. So today our panel will talk to us about telehealth, the rise of interest and innovations, and what's going to happen next as this trend keeps growing. Over to you, Karamjit.
Okay, excellent. So you're right. These conversations are all about highlighting some of the innovations and the applications that we're going to see happening, right? Because of this epical moment, in the history, in all our lifetimes, so not even history, in all our lifetimes with what the pandemic has brought about. And what we're going to do is, I've already introduced both of our esteemed panelists. We're going to start with Nadiah. Why don't you share your thoughts on where you see what's happening in this space, and then after that, we're going to go to Maran. I got some questions, and of course, I'm sure the questions will start piling in from the audience. So the floor is yours.
Thank you.
Let's say the screen is yours, Nadiah.
Thank you, Karamjit. Hi, everyone. Good afternoon. If I could have my slides up. Yep. So I know how everybody hates PowerPoints, but I'll just right off say that I'm here speaking as a representative of TMC Life Sciences Berhad and Thomson Hospital Kota Damansara, and speaking from a provider's perspective on how telehealth fits into the whole puzzle that is healthcare. Obviously, healthcare is a very complex industry with a lot of complex problems, but that's why we're all very passionate working in it, trying to resolve the issues. So I'll just give a little bit of overview into what are the trends that I've been seeing over this past few years and where I think things can go. So obviously, I think when we saw COVID first come out last December, and then a lot of lockdowns being put in place, people, especially providers, were very quickly putting up teleconsultation platforms, which at least enabled patients to speak to the doctors because they could not get permission to. In our case, in Malaysia, there were roadblocks everywhere. It was very difficult to move around because they were controlling movement with the movement control order. And a lot of people very rapidly put up platforms so that they could just call and consult with their doctors safely and securely. But is this really just it for telehealth? In my career in healthcare, I've had the good fortune to meet with many colleagues from across the countries. And one country that in particular has been very interesting is China. Now, China, like many countries, has a lot of disparity. Because of its size, that disparity is rather emphasized as well. So in China, you find that you have, for that few billion population of people, only 4 million doctors and nurses. And so the problem of access is very acute in China. But my colleagues are very optimistic using telehealth in China. It has been very long established, but they have recently moved on. I think with the potential of rollout of 5G networks, they're really pushing the envelope in terms of what can be done. And so last year in China, we heard news from our colleagues that they are even performing remote assisted robotic surgery, where this surgery was conducted a few hundred kilometers away by a specialist using a Da Vinci robot on a patient who was unable to travel that distance. And so this is really pushing the envelope of what we think of telehealth. But I think coming back to where we are, there's, I think, a spectrum of possibilities. And a lot of times, I think the chatter about telehealth is around teleconsultation, about e-pharmacy, but there's a whole B2B, I think, perspective that is perhaps hidden from most consumers. In our case, I think teleradiology, telepathology has been in the industry for some time, and many hospitals are actually outsourcing, particularly I think taking advantage of different time zones so that they can have access to service 24/7. And it's all about efficiency of resources. Of course, you've seen in China remote surgery already happening. There's also instances of remote monitoring. For example, ICU beds and ICU nurses are a very, very scarce resource in healthcare. And there are examples in certain countries where you have the patient sitting in a bed somewhere in a small town. And because of the equipment that we have, because of the connectivity that we have, the monitoring for these patients by the physicians or maybe the senior nurse supervisors is actually happening in another hospital. Coming back home as well, a lot of times second opinion, as patients become more educated about their rights, they want to get different opinions from people. And a lot of people utilize teleconsultation to get a second opinion, because that means that they can get a consult not just from doctors in your own country, they can get a consult from doctors in another country. And we are seeing that particularly, I think, in Malaysia with patients coming from from Indonesia and in other countries who want to have a conversation with a doctor before they go through the hassle of actually packing their bags and coming here. We also have tumor boards. Now, tumor boards are, for people who do not know, typically a platform used in cancer management, where a lot more multidisciplinary specialties are required for discussion, and you are pulling in different peoples, from surgeons, the oncologists, maybe the nuclear medicine physician, the pharmacist, and a lot of our diseases right now, when we talk about non-communicable diseases like diabetes and cancer, requires people from different backgrounds to come together, review the data, review the results, and discuss about what needs to be done. And the reality is that we want this discussion to happen, but we also want a platform where that discussion can happen securely, can happen seamlessly. And so I think we're seeing a lot more of these, and we are actually exploring tumor boards, looking at, because cancer is such a hyper-specialized disease. There are people who just specialize in not just one type of cancer, but one subset of maybe breast cancer. And having their opinion on board is very vital. And so we were exploring, having virtual tumor boards with doctors, for example, at Brigham and Women Hospital in the US. And that has been something that doctor-to-doctor telehealth, I would call it, has also been very important for the development of cancer treatment. And of course, continuous medical education as well. Again, we saw during the COVID period, a lot of CMEs being held by experts in Korea, in China, who are at the forefront of fighting COVID, and we were benefiting tremendously. There were webinars that were being held every 2 weeks, learning from the mistakes or experiences of our colleagues in different countries, and that has been, and I consider that part of telehealth as well. So there's this whole B2B side that I think is hidden from people. But of course, I think when we talk to the public, they're more often excited about the B2C portion. And I think within B2C, I think the possibilities are there for a certain part of healthcare. Naturally, of course, we can't probably have, in Malaysia, the need for remote surgery probably isn't really there, just because we don't have that massive access gap or distance. But the integration of teleconsultation, e-pharmacy, services, perhaps like rehab, particularly mental health. So there have been startups who are coming up who are doing, mental health, because the DG just announced yesterday the shortage of psychologists that we have in this country, whereas the stresses that are happening in our lives is definitely increasing. Online coaching as well. So we are exploring a lot of the diseases that we're facing right now, frankly, are lifestyle diseases. They're not going to be solved by one pill. They're not going to be solved by one meeting with your doctor. And we are looking at device companies working with Apple and the Apple Watch to look at how we can integrate this monitoring. And we're also looking at coaching because it's about behavioral change. So right now we have our endocrinologist, getting his patients to text him pictures of what they're eating every day so that he can monitor what's happening. And so the reality is that people are using all sorts of technology. In Malaysia, WhatsApp is very commonly used. And the question comes in terms of the security and how stable it is. And I think that there's an opportunity for telehealth providers to come in that, because there's obvious need that's out there. as I mentioned, continuous monitoring and AI. It's been many years now that the device companies have been talking about integrating their devices. So glucometers, blood pressure monitors. I think the most common one right now that we are seeing is thermometers. So temperature checking is becoming a reality, a fact of life. People are rolling out gadgets, linking that to an automated system so that people can track whether your temperature is more than 37.5 degrees Celsius. So we see that already happening. There's a tremendous amount of solutions that are rapidly coming out, all being accelerated by the COVID outbreak. So just a little bit background about why I'm passionate about this is I'm the CEO of TMC Life Sciences Berhad, and we have a hospital, we have clinics in the TMC Fertility Center. We also have TCM and TMC Care Pharmacy. So we're looking to build an integrated health platform. And obviously technology is a very important part of that. And so just roughly what has happened to us since COVID happened? We started to see three things. The first thing was the rapid decentralization of services. Okay, so because of social distancing measures, because people were afraid to come in, we had a lot of drive-through and at-home services. We launched the drive-through COVID test way back in March. We had drive-through vaccinations now, and we have drive-through blood draw and go even in addition to e-pharmacy. The second one is system integration. I think a lot of people don't realize how siloed systems in healthcare can be. And there's an opportunity there to really bring this together because you want to offer a seamless online experience, just as people expect a seamless in-person experience. And in order to do that, you need integration. And we just recently launched our Thomson Hospital Online, where we have an integrated telehealth platform together with prescription and pharmacy. And we're looking to add other services on board once the platform has really stabilized. So that's where we are right now.
You said you launched your platform online very recent, or was it before COVID became a reality in our lives?
Very recent, yeah. We launched all the drive-through services first. Now, a lot of people have launched teleconsultation platforms as a knee-jerk reaction to COVID. I think that COVID has definitely accelerated things, but I don't see this as a short-term plan. So when we built the telehealth platform, Thompson Hospital, we are in this for the long haul. We think that this is the way to go. And once people feel, there are three things that we're really passionate about with our telehealth platform. The first is convenience, of course. The second is transparency. Transparency in terms of cost, transparency in terms of the waiting time, transparency in terms of the person that you're talking to. So that's the other thing. So I think that all of these things is very important to us, and we have taken our time to build it up. And we're definitely, this is not going to go away once COVID is solved, though I think that COVID won't be solved anyhow in the short to medium term. Okay, so from my perspective, what are the chronic issues in healthcare? The first is access, which I think in Malaysia and countries like Indonesia, very clear, lack of specialists, lack of facilities. The second is efficiency. Where in healthcare, because you have a lot of complex actors interacting who need to rely on one another, there's an issue with coordination and flow. So a lot of times people are complaining about, why am I waiting? What is happening? What am I waiting for? Why is my lab result not out yet? And the third one is value. Talking about cost, of course, with escalating healthcare costs, and also the value to me as a patient in terms of how can you deliver personalized care, right? Because the trend has always been, if I can, build my own iPhone down to the type of RAM and the color, why is this healthcare service not personalized to me when it's something that's so personal? And I think that telehealth has the potential to address these issues because it allows us to decentralize services, but work with centralization of resources. And of course, having something that is tracked online and seamless online does help with coordination and process flow, because then you have services on demand. You can deliver the service to the patient at home. You're not constrained by the physical realities of what's happening within the hospital. And the last part in terms of value is continuous care monitoring. Transparency is very big. I think people are always looking for transparency, and the amount of data that's being generated will also help us in terms of predictive care, which would help in terms of personalization of the healthcare service to the particular patient or a population. So last but not least, I think things to consider. Cultural change, I think COVID has played a very important part in terms of changing people's perception and acceptance of telehealth, particularly among the healthcare providers. Maybe the consumers were always open to it, but the healthcare providers are a little bit more conservative, and that has certainly changed with COVID. Infrastructure as well, people are a lot more used to having video conference calls now. They know what they need to do. Of course, there's always the issue of legal and ethical frameworks, but that is always omnipresent in healthcare whenever you have any sort of new developments. Cost and economic restructuring, because the reality is this could disrupt the way people deliver businesses. So if I could see a psychologist online, do I really need a psychology in-person clinic? What's going to happen to the GP clinics? What's going to happen to the brick and mortar businesses? But that's the reality of a new digital economy. And those problems aren't going to go away. And I think that it's our responsibility as leaders to make sure our organization can adapt to this new normal. So thank you. Okay, very good, Nadiah. I think you're right. All of us have to adapt, right? You cannot resist. Because we've seen those who try to resist, it's an exercise in futility. You're just delaying the inevitable. And eventually, the other parties of the ecosystem stop resisting and they adapt. And you find yourself being the lone one left resisting. And you're the customer will leave you behind. Customer wants the best value, the best service, right? And that's why nobody ever bothered, when you talk about Grab, nobody ever worried about the legality of it. The service was fantastic. It's visible. It's transparent. It's incredible, right? It changed the way people live, and the cab industry has had to adapt. So we're seeing that play out now. And now you're going to start to see some elements of that play out, I think, within healthcare too, especially with telehealth becoming, a part and parcel of the whole ecosystem, not just a sexy or fringe, service available. Yeah. Now, talking about sexy, we've got, the very forceful, maybe not sexy, Maran Virumandi, who's an entrepreneur through and through, and he's been in this telehealth space now for like 5 years. I think 2015 or 16 you started it, or 17, right? Was it? What year, Maran? Sorry, 2000 and?
Well, we started our early work in 2016, but officially launched in 2017.
Okay, so he's been in this space for over 1,000 days, all in. So as coming from an entrepreneur's perspective, Maran, give us your take on where you see telehealth going.
All right. Perhaps I can just start off by presenting the PowerPoint and then walking you through the slides and giving you a perspective on how Dr. On Call has evolved and grown over the last 3 to 4 years. So a little bit about Dr. On Call to the audience out here. We are Malaysia's first and largest digital health player. As Karamjit had spoken, we started back in 2016. We offer telemedicine services, an online pharmacy, medication delivery, credible health-related content, as well as doctors and health specialists booking services. So our aspiration is really to enable the healthcare ecosystem by providing an avenue for the doctors, labs, pharmacists, clinicians, hospitals to actually come together and serve their members in a more accessible and more affordable way. Okay. And I think we also have to remember that there's a lot of pressure on the payer side of things. So we've been actively engaging with the insurers as well as corporates and the state government, and of recent times with the federal government on how we could actually help them, because healthcare costs has increased by a 15 to 20% CAGR year on year over the last 10 to 20 years. So it is a serious economic discussion besides just looking at it from the public's health and safety perspective. So moving on to the next slide. A lot of people tend to limit their discussion or their thinking about telemedicine as a typical visit doctor, get consult, get diagnosis, get drugs, and leave clinic. Okay. But when we actually scour through the Facebook, YouTubes, and Google searches, you see a whole significant unmet need from the healthcare perspective around trendy health marketing questions, around the dangers or the myths of traditional drugs and treatment, around the effects, the side effects of illegal drugs or self-medication, and even non-prescription drugs. So there's a whole plethora of questions that come about in our heads. And we typically resort to Googling it up or YouTubing it up and opening ourselves up to non-credible and non-licensed healthcare providers providing all this advice and services. So the question that begs to be asked is, why does the public head down that path? And the first answer has to come about with this scene over here. It's a typical scene that greets you on a day-to-day basis in the clinic kesehatans and the hospital bazaars across the country. Mind you that the public healthcare infrastructure and services in Malaysia or delivery is really world-class. And,
correct, yeah.
And we have a lot of committed medical professionals over there, along with Ministry of Health, that looks into all the key performance indicators of waiting times and patient outcomes. But we still beset with these issues due to the overburdening demands from the population, right? And we have to think about it also beyond the boundaries of KL and Penang and JB, because there's a significant population that are out there in the small towns and the small kampongs who don't really have easy access to the specialists over in TMCs or even the major hospitals, right? And if we were to look at it deep, a deep dive into the numbers, you have to see that Ministry of Health has done a phenomenal job at driving the patient to doctor ratio across the last couple of years, right? It's on course to hitting the 1 to 400 target.
Oh, wow.
But when we deep dive to the picture from a state or geography level,
correct.
it paints a completely different picture. So, the best place to get a heart attack or get hit by a bus is obviously in Putrajaya, because there's perhaps more doctors there than there are cab drivers with the
I didn't know that
standing ratio. And if you were to come out to KL, you'll probably have a better number because we have a lot of clinics in our tamans and our bangunans as well as our shopping mall. But go beyond that to Kelantan and Sabah, and you have a dire picture over there with close to 1 to 700 or 1,000. And in fact, if I were to narrate a story that I heard from a good benefactor and a well-known figure who invested close to RM250,000 in building a clinic in his kampung back in Sabah.
Wow.
But 6 months down, he gave us a call and told us on how he couldn't get a doctor to service his clinic.
Okay.
And you can't blame the medical professionals, because there's not many people out there who want to pursue a career path in a small town over in Sabah. But mind you, he was doing a video call with me, so obviously the internet penetration and the infrastructure from roads and flights are pretty good for him to get there, right? And here are cases where telemedicine and digital health can offer an alternative channel. It also seeks to alleviate the mobility issues. Over in Doctor On Call, we serve many of the state-run healthcare programs for the B40, in which they get a minor wallet, and it's typically targeted for the makcik kias of Malaysia, right? Who can't really afford a 30 ringgit cab ride to the clinic kesihatan once a month for their chronic conditions. And here's a safe way for them to get advice from a medical professional, get medications delivered to them if required, and even try to organize their lives in a more structured manner. Expanding on the topic that Nadiah spoke about regarding chronic conditions, right? We are facing an NCD or chronic disease epidemic, right? With 1 out of 5 Malaysians suffering from diabetes, 3 out of 10 suffering from hypertension. Real staggering numbers if you look at it from a population perspective of 3 to 4 million people having these chronic conditions, right? And requiring monthly or frequent medical advice, visits, checkups, and all of that is going to put a strain on the resources of our public healthcare system, as well as our private healthcare providers, if we just continue to rely on the standard channels of a face-to-face encounter with your doctor. And if you were to overlay the economics of it, now here's some data that we had gleaned from the work that we have done with many of the corporates in Malaysia, where it's a clear-cut picture, right? That it costs about 2 to 3 times more to serve a chronic patient as opposed to the average population. And so when, on a point that Nadiah had mentioned about transparency, which allows for patients to have the options of looking for a provider, be it a pharmacist or a lab or doctor and specialist that can fit their wallet, and if it is within the geographical area, but in the case of telemedicine, it goes beyond that, right? It becomes a real key point when you're spending 1,000 ringgit a year just to cover your diabetes or hypertension conditions, right? Obviously, in the backdrop of the roti canais and the nasi lemak in Malaysia, I don't think this is going to go anywhere anytime soon, and it's just going to worsen over the years.
Oh boy.
So how has COVID-19 panned out around the world, right? It really has been a major boon to the telehealth players. As you can see with the Amwells and the Practos and the Ping An Good Doctors and the JD Health across the world, right? Having up to 5 to 10 times increase in telehealth encounters, be it phone, video calls, prescriptions, and China-wide. I mean, and I think this is to the point that Nadiah had mentioned earlier, right? Where they have an acute situation from a doctor to patient ratio, right? You see a large increase of up to 20 times during the COVID-19. And again, mind you that they were the first to be hit by the Wuhan virus, or what's now known as COVID-19. So when we were talking to our counterparts over in China, they were talking about a huge onslaught of queries coming down regarding fake news, misinformation, people being scared of symptoms, and telehealth was there as a real lifesaver in many cases to offer patients, the comfort as well as the consults. So that has panned out from the regulatory perspective, right? With a lot of the countries which were either sitting on the fence or not too open with telemedicine just because they didn't plan and manage it as a program, suddenly being forced to adopting it. And across the board, right, whether it's in US with Trump expanding Medicare telehealth coverage, to the UK with the NHS adopting appointments as well as consults through telephone or video, as well as Australia with extension to Medicare. But what's been really interesting is the use in China, Korea, and Taiwan, which was already adopting telemedicine to a large extent to serve the needs and the fact that they have a population that was more open due to the advancement in technology, for them to leverage on telemedicine and the data that you could glean from it or you could collect from it, to then start using big data and AI to really help the population from the tracking, the contact tracing, the provision of advice, and announcements. And even in the case of Taiwan, they actually use it proactively to identify suspected cases, right? By marrying or triaging the immigration data with the health records and seeing people at risk. So A classic case is if you have a history of pneumonia and it just flown from Taiwan, you would have a proactive visit from the Taiwan medical authorities to have you tested, because you'd be the highest risk of individuals should you get COVID-19, and that has turned out. I mean, if you look at again these three countries, right, having the first exposure to COVID-19, but miraculously, and I think it's more than miracle, it's due to the proactive stance, being able to get a handle on COVID-19, as opposed to what we've seen in a lot of countries in Western Europe. So what we've observed in Malaysia was a very forward-looking Ministry of Health. Led by the minister himself, as well as the DG and his team, who Datuk Nur Hisham, who leverage on Doctor on Call, as well as other digital health players, right, within the ecosystem, to provide free online consults, webinars, appointments, lab bookings. You remember that a lot of people were unclear about where can they get themselves tested, right? And they could just jump on the net through Kementerian Kesehatan's website, be directed to the relevant websites that we were seconded to provide these services. And I think this approach of being open-minded and leveraging on technology helped them to come to the point where we are right now. You know, one of the best performing countries in Southeast Asia and even the world in terms of arresting this condition. So a little bit of a snippet on how we can learn from the government themselves, right? In terms of providing digital services, digital health services. We started off by identifying the root cause of the issue, which was the large or the clinic kesehatans and the hospitals being inundated with people coming down for COVID-19 related inquiries, and KKM wanting to offer a solution so that they have that precious resources around the hospitals and the clinics, not to cater to simple inquiries, right, about beds. And even if you remember back in the early days, right, people were afraid of beds or afraid of, you know, people coming from China or pneumonia-like symptoms, right, and a whole bunch of fake information. So we offered them help forum and help blog, which allowed the patients to educate themselves, to self-answer, not self-answer, but get an answer in a more immediate fashion. We also offered the COVID-19 risk assessment, which was initially done in Bahasa and English, but now has been extended to include Mandarin, Nepali, Tamil, Bangla, and languages for the foreign workers. As you know now, the issue is more prevalent with the foreign workers or the migrants, right? We also offered the telehealth services for them to be connected, for the patients to be connected to doctors over in Kementerian Kesihatan, for the doctors to then consult and offer a referral for the patient to perform a test if required, right? And all of this culminated in us having up to 5 million visits to our site during this period, and over 2 million risk assessments done, and 40,000 consults, or rather inquiries and consults and interactions with doctors as well as private players being performed. And you know, we're happy to report that a lot of the services were well received from the public and was timely, and I think that's a key point.
These are in the various languages, right? Not just in English, right? Because you have 2 million consults, right? You were saying?
I would venture. I think based on the latest stats, about 20% of that was done actually in foreign languages, beyond Bahasa and English.
Okay, wow, interesting.
Yeah. So, so I suppose, in conclusion, we are now fortunate for Malaysia and Ministry of Health. We are partnering with them to extend these services just beyond the COVID-19 space, to the clinic kesihatan and the hospitals around the country, but it's still in early days. But I think what's really good is, with the leadership of CEOs like Nadiah, as well as many of the clinics and labs and the pharmacies out there, I think we are at the cusp of a mass adoption by the healthcare providers.
Interesting.
Right? Because they're the ones with all those specialists and the body of knowledge and experts
facilities,
who are now open to leveraging on this and understand that it's not a be all and end all, but it's more of a complementary service that will serve as an alternative channel, as a means for them to grow their business and for them to serve their patients. So back to you, Karamjit.
Wow. No, it's very interesting. I think the experience you are having, Maran, doctor on call, working with the state governments and delivering that service to a lot of Malaysian citizens who don't live in urban areas. I think that's amazing. That's amazing insight for people who are curious to see the value of telemedicine, telehealth. You should look at what the state governments are doing, and the fact that they're reaching out to players like you, not just you, of course, to say that, hey, help us, serve Malaysian citizens better. That's great. It's a great leveler, so it's very interesting. And first of all, we're going to go on with some questions. I want to thank all of you for the privilege of your time, for being with us, and so many questions are coming through. And with that, I want to just give a shout out first to Dr. Aminuddin Saim, who's with one of the private hospitals here. And even before our event started, he has already sent one question to us, and we want to get that off the board first, because clearly, none of us here profess to be legal experts, and I already see some questions around the legality of it, and that all will be worked out. But he did want to ask, actually, as part of his question, was whether both Maran and Thompson Medical Services are qualified and are able to give these services that obviously there's a market demand for. So maybe I'll give you a break first, Maran. You just spoke, and that Nadiah take that, then you can answer that question also. And then we'll go on to two questions I have, then we'll take some of the questions all of you have been putting out there on the Q&A board.
Well, thank you for the question. As I said, this legal ethical frameworks are definitely an issue to consider. But what has changed is the acceptance level, not just from the providers, but also the regulators and also the other players. So, for example, for Thomson Hospital, the doctors who have signed up teleconsultation have actually all also gotten consent from their medical indemnity providers. And the medical indemnity providers are now looking into this because they realize that with COVID, everything has been accelerated and they're more willing to change now. So I think we should use this crisis as an opportunity to really accelerate the movement towards the change that we know was going to happen anyway. And if it can happen earlier, we should reap the benefits earlier and not wait. So I think what COVID has given is that it has allowed, there's this much more willingness to change now on behalf of the regulators. And of course, we're always thinking about patient safety as the primary concern. So that has always been there. But in terms of consent, how people access information, the willingness of providers and payers to now consider teleconsultation, we definitely see more willingness there. So perhaps the law is lagging behind because, well, frankly, they haven't even sat for Parliament. So you want to expect parliamentary act to change. In concert with what's happening on the ground. It may not happen, but in conversation with regulators, they're definitely pushing for more teleconsultation because the primary objective now is social distancing. And they know that this is one of the key things because you don't want to cut off access to care. So what is the best alternative? So I think that we should use this crisis as an opportunity.
Yeah, exactly. And I think for those who are, before Maran, you answered it, for those of you who are maybe not from the medical field, you may not know that actually the Ministry of Health, which is incredibly forward-looking and, let's work with this, has already engaged, hired a party to work out, a framework, a consultation with all stakeholders to re-look seriously at our regulations and how we can how we can get with the times, right? Simple as because the regulations are maybe outdated. So that's all great, and that's all happening as we speak. Very serious, very intense discussions going on, and I'm sure Dr. Aminuddin is in the thick of it also. I see so many questions coming from in there. Power to you, brother. But in the meantime, Maran, okay, you why don't you take that question about which Aminuddin had, right?
Well, yeah, I can see a whole slew of questions coming from Dr. Aminuddin, and I think the approach to telehealth or digital health needs to be a pragmatic approach. And we were fortunate that over the last 4 years, we've been working with a group of stakeholders in Kementerian Kesihatan, as well as the relevant authorities, right? MMC, Bureau of Pharmacy, the group of doctors, through a group such as Digital Health Malaysia. Prior to that, it was called Telemedicine Development Group. And there's various groups or associations that actually seek to formalize this place, right? And rightly so, because the risk of not having some form of regulation is the fact that you're going to have a cowboy show, right? With many players who may be abusing the system and abusing the doctors as well as the patients, and putting a lot of people at risk. The question about regulation is the right question to ask. And
absolutely,
we've also been fortunate that through working with these relevant groups, there's been a body of knowledge that's been uncovered around the telemedicine practices in the US, China, Singapore, UK, that we can leverage on. And if you were to adopt the pragmatic approach and then transpose that to the Malaysian scenario, that is really the work that's being done at the moment, right? In which Ministry of Health is engaging with all the players, because they know that we're never going to go back to the post-COVID-19 era, where people are just going to be content to going for an in-person visit. Right. The mere fact that we're conducting this webinar in person, as opposed to what Prem had envisioned, to do it in Bangsa with 300 to 400 people, right, having coffee and having a handshake, is a testament to the times that they're living in. So the way to move forward is to engage all the parties and recognize that the health medical sector is very regulated. There are licenses for doctors, clinics, hospitals, pharmacies. So in fact, I would venture a guess that we're perhaps over-regulated in some cases, right? And that may form a restraint to the innovation and the movement forward for the medical professionals. But if we now need to look at the digital health field and answer some of the questions regarding privacy, security, authentication, and make sure that we frame that up so that now the industry can be recognized by both the patient, the public, the payers, as really part of mainstream healthcare, not just the fringe, right? But a real way for a patient to seek healthcare. And then, we can just let it flourish and be the first mover in this region where there's a huge competition already taking place, right? With, digital health players flourishing in Indonesia, as well as India and China.
Sure, exactly.
So maybe now, I think there are a few questions there that maybe we should address, because I think we don't have much time left. And first, Dr. Jason's question is very popular there. I think that definitely, I think with COVID, you see that there's a digital divide, right, between rural and urban areas. And it's not just affecting healthcare, it's affecting other sectors, particularly, I think, education. So definitely, I would think that most governments would be interested, knowing that COVID is not going to be resolved so soon, to actually try and reduce that inequality in the digital divide. But I think what's also important is that when I go back to what is telehealth, it is not just a B2C component. And a lot of times, I think what we see with the government in particular, and what we're doing even with our branches in other towns like Ipoh, is we're having this B2B telehealth between the health providers, because you may have a subspecialist who's living in Kuala Lumpur who can then provide advice to the doctor or the nurse who's seeing the patient out in a small town out. And I think that is a very powerful way of addressing a lack of access to medical specialties. So yes, I acknowledge that there is infrastructure issues, but I think that we're going to resolve them both ways. One, the infrastructure definitely needs to be developed, but secondly, there's also this B2B component that can still go on, even if the patient themselves don't have access to good internet.
Yeah, not gone, it's already going on, right? So everybody is using. There's huge value there. At the end, what goes on in the B2B ends up delivering a better quality service to the end customer, right? It's not done in a vacuum, so very important.
Yeah.
I think I heard
And
the
then,
yeah. Go ahead, Nadiah.
oh, sorry, there's another question about teleconsultation in Singapore. Because, you know, Thomson does have a hospital in Singapore, and our doctors do sort of collaborate in that sense, particularly because we also have a clinic in JB. So now JB and Singapore are very close relationship there. And the legality is actually more on the Singapore side, because it's always the liability on the doctor. And so it is up to them whether their medical indemnity covers for that. But I believe that in Singapore as well, they have rolled out a lot of these teleconsultations, and oftentimes it is the comfort level of the physician, right? So we're paying for their experience. If it's a patient that they know, they have seen before, a lot of times they're very comfortable giving a consultation, or they might say, you know, they might preface and say that this is my initial opinion based on the lab results, the imaging results that you said to me, but you will have to come and see me in person. And over here in Thomson Hospital, we have a policy. If you did a teleconsult and you need to see the doctor for whatever reason within 24 hours, that second consultation we do not charge, because we are, you know, you're paying to see a doctor to get an opinion. If they feel that they can't give an opinion purely online, you need to come in, then that's fair enough. That counts as one consultation. Okay,
interesting. We've got, I think that's very important when you talk about digital, because all this information is digital. And one of our pre-conversations, you know, we were talking about how the more data you gather from a patient, you know, the better you're able to deliver a qualified opinion, or just help them better, right? And I think Kumaran Ramakrishnan had a question here about with virtual consults, whether they're recorded, and if it's recorded actually by the patient, and if the patient decides to upload it to social media, or can it be used in court? So it's kind of interesting. These are the scenarios that could happen, right? So do either of you want to just address this question?
Right.
Well,
let Maran go.
Nadiah, go ahead.
Yeah, let Maran go.
Okay.
Maran,
from our experience, right, first of all, we don't record videos the telephone consults that are done, and so the data is secured, is encrypted. There shouldn't be a way for anybody else to have access to the information, and certainly not from the doctor's side. But we have been asked these questions before about you know, either the providers or the patients recording themselves, right, on their own respective devices. So frankly speaking, I'm not too certain about the legality of that, and whether that information can hold or can stand in court or in any legal discussion. But obviously, from an ethical perspective, it's not the right way to go. And I certainly hope that, you know, our public and our patient can actually be mature.
Patient education, correct.
Right. So you're not only opening yourself up to having your information being stolen, whether it's in your laptop and then being shared across, right? And because you typically engage in very private conversations with your doctors about your health, and so they should. But nevertheless, if they do have instances of complaints, valid, you know, customer-related service levels and doctors' bedside manners, we do provide them a channel for them to actually provide those constructive criticisms, as well as, you know, questions regarding refunds, regarding the, you know, and follow-up questions, right? We do provide that channel for the patients to actually then come back to us and provide their grievances. So what, based on our observation in Touchwood, you know, there's been absolutely no occurrence of that in the past, and we certainly hope that, you know, there's clarity from the Ministry of Health, right, regarding such occurrences, because in the physical clinic, from what I gather, there is a rule about non-recording. No recording in the physical clinic, right? Again, for the same reasons of, you know, of privacy.
Okay. All right. So look, there's some. I think there's a most recent question was on doctor on call's business model. This is not the forum to answer that. So if you're interested, you can take it offline with Maran. But I think earlier both of you kind of touched on how COVID has changed the game. With the new normal we're living in. So what do you feel is going to be the new normal for healthcare? With now, of course, telehealth becoming a more and more important component. And I was actually struck, Maran, by the chart that you showed, the global snapshot, and all those updates are real time, right? So these developments, all of you that are happening in real time. Bill Gates says information moves on at the speed of thought, right? So we're all learning from each other almost in real time. Nobody's going to be caught behind 1 month later. Oh, this happened last month or whatever. Everybody's learning and maybe making mistakes and learning and moving up and all the time, right? So it's exciting that I think Malaysia is definitely at the forefront. We're not behind. We've got I think the whole world knows we got a fantastic DG of Health there and the ministry, and they're all doing their best to deliver value to all of you out there. Fantastic questions coming in too. But just again, my question is, how do both of you feel COVID has changed the game? What is going to be the new normal for healthcare now?
Nadiah, would you like to?
Okay. So I think that definitely telehealth is going to be another important pillar. And I think what we see with telehealth is that it's not going to be differentiating different hospitals or providers that you provide telehealth. But I think that what will become important is the competitive landscape will change, and there will be other non-hospital or healthcare players coming into the market to actually step into the service. Now, Ping An is an insurance company in China. Yeah. Okay. And you will see, and we already know companies like Amazon, like Apple are also going into healthcare, and this will be one channel in which they can come in and really change the game. So in terms of competition, you will see, I think, many non-traditional players coming into the market, and hospitals definitely have to adapt. So just having the platform isn't going to be a differentiating factor. So what will be is the data and the transparency and what you do with that in order to improve the level of service to your customers. So there are questions about what are the considerations. For me, I think system and data integration and security is top priority, because with telehealth, there is a transparency. What kind of, which doctors doing more follow-up consultations? How long are those consultations? What medications are they prescribing? Can we integrate their active monitoring tools? People wearing Apple Watches, can I just get what is your heart rate for today? So there's a lot more data, there's a lot more transparency into the process, and what we do with that data becomes very, very important in order to see how we can improve that service. So for example, now the Ministry of Health, because of COVID, has extended the operating hours of outpatient departments to 10 p.m. because they can't deal with the load. Now, with telehealth, and this is happening in healthcare all the time, we have remote reporting of radiology, so that the radiologist doesn't literally have to sit in the hospital until midnight if there's a person coming in with a road accident. So this is what is happening. And I think it's not just improving the experience for the patients, it's improving the experience of the healthcare providers, which is important because we don't have enough of them. And if they get burned out, if they decide that, screw this, I'm going to move to another country, we are going to be at a loss. So we need to think about the healthcare providers, because at the end of the day, telehealth is just the platform. But what you're paying for is the experience of the doctors and the nurses in order to listen to your issues and diagnose what is the problem and help you through your recovery journey. And I think it also facilitates collaboration, is what I was saying earlier. Very important. That you can collaborate cross-border. Of course, there are always legal issues that are involved, but I think with a B2B model, the legal issues are more or less settled because you always have a local entity or a doctor who is managing the patient. So it's not a case where I can remotely manage you from afar, and if something goes wrong, I just wash my hands out of the whole problem. So that's one thing. But I think that collaboration in medicine is very important. The problems are complex. And why should we limit ourselves to accessing resources to those that are just immediately within our vicinity? It just doesn't make sense. So I think that there's a lot of potential for healthcare providers, whether they traditionally come from healthcare or whether they're coming from an insurer's perspective or a technology company's perspective, to really look at what are the opportunities that are being opened up right now in terms of telehealth and where we can take this forward to improve. Ultimately, our goal is to improve the outcome for the patients and for me as an employer, also for my staff. to make sure that they have a good quality of life, that they are satisfied in providing good level of service, because nobody wants to wake up and say that I did this patient wrong today.
Yeah, exactly. Yeah, true.
So,
Okay,
Karamjit, just building on that in interest of time, right? Building on Nadia's answers, we're seeing a confluence of a few key trends that's coming on board. In the past, we've always had questions from the provider's side regarding the questions about legality and regulation, and because they are a conservative bunch due to the regulations that they've lived through, right? But now with COVID-19, and more importantly, the COVID-19 led recession that we're seeing coming upon us, right? With offices closing down and factories closing down, and people reducing their entitlements and benefits. There's a lot more awareness about the economics and how that's going to impact the clinics and hospitals. So there's already news about 200 over clinics closing down over the last couple of months. Not too sure whether they're going to come online post MCO, but the jury is still out there. But there's a lot of talk about the fact that it's going to be very difficult to operate for those GPs, for the pharmacies in a country that's facing recession and facing COVID, right? The twin impact, right, over a prolonged period of time. So they now see digital health as a channel for them to reach out to a new market segment of people who procure online, and also beyond the geographical boundaries. So you could be a really good doctor in KL or over in Penang and Perlis, and actually expanding your market to patients across the country. And just simply based on your merit, your skills, your customer service, and joining, and you need to join a digital health platform. We are also very aware that the medical tourism business, which is a huge business for Malaysia, is going to be severely disrupted. But if we use telemedicine smartly, we can actually get ahead of our peers over in Thailand and Singapore in terms of addressing this latent but real demand coming from various countries across the field, right? So we could have a pragmatic approach of performing the first couple of consults through telehealth, and then getting them to come back, because Malaysia looks like we are going to get out of the CMCO in a much earlier timeline than those countries. But obviously subject to quarantine rules for the people coming in. But they may actually agree to those trade-offs, right? Assuming that you're facing a very huge, hefty medical bill or a severe case over in Indonesia or Vietnam, and you seek proper medical expertise in Malaysia. So there's various cases, right, with the recession and the affordability issue, as well as opening our minds up to new markets, that is going to allow for this business, this telehealth business, to becoming part of mainstream. And I think we just, and it's good to have, clear leadership from providers like Nadiah, as well as people out there who are embracing this.
Sure. No, I think it's interesting that you mentioned also affordability. Yeah. Now, I think we've got our closing poll already on. If you go to your poll tab there, there's a closing poll there, so you can have a look and just address that. Prem is already on, ready to give his closing remarks. But let me, before Prem comes on, as a journalist, you always want to get one last question in. Nadiah, because Maran mentioned affordability, and if all of us have experienced that in the digital world, where in the early days Grab was too cheap, right? Crazy cheap, and then it became reasonable. And then a lot of people say Grab is expensive now, but because the value has been proven, people still use Grab. So coming now to the very early days of telehealth, Nadiah, what do you think of this issue of affordability? Do people are going to expect that it's going to be cheaper? So what are your thoughts to that? And then Prem, you can come in your closing remarks.
Yeah, I think that's similar like what you said. People think that digital ought to be cheaper upfront, but later on when they see the value, it's not necessarily cheapest, but they still keep to it because it actually fulfills their exact needs. So I think with digital, you can be a lot more targeted. I think I take the analogy of digital marketing. Initially, people switched because they said it was cheaper Today, I can tell you that it's no cheaper than traditional media, but people use it more extensively because it's much more targeted. Now, similar with healthcare, I mean, telehealth, I also encompass everything, including electronic medical records. What having more data does is it gives us more transparency. When I have more data, I can run estimates, be more accurate in the estimate of what exactly is required to treat your condition, how much can you expect to pay. With a teleconsultation, we can also manage the doctor's clinics much more efficiently, manage the hospital operational flow much more efficiently, and we can pass those efficiency gains to our patients. So for example, with the teleconsultation platform, we know that there's a defined time limit and that patients and the doctors are agreeing on a time to their convenience. And so for the doctors, they're happy to just set a fixed fee for that consult. So rather than referring, let's say, to the fee schedule in the Private Healthcare Facilities Act, which gives you a range, there's less transparency there than having the doctor saying, okay, for teleconsultation, I'm going to spend 15 minutes with this patient. For my specialty, I'm going to charge X. So that is what we have done in Thompson Hospital. If the patient logs in, they know exactly how much they're going to pay per specialty, which may change because, for example, in fertility, we know that doctors spend 45 minutes counseling patients, and so they may end up paying 150 versus someone who's just reviewing your blood pressure and saying, okay, continue your medication, maybe it's 50 ringgit. So at least there's transparency to the patients, and I think people want that. They want that transparency. What am I getting? How much is it going to cost me? And how long is it going to take? And telehealth is just going to help us providers make sense of the more complex, flow and infrastructure, and allow us to give that transparency to our customers.
Good. And hopefully no more jaw-dropping moments. I took my son to a private doctor, I think about a month ago. And then when I got the bill, my jaw just dropped, and the nurses were surprised.
I'm afraid to say that happens more often than not. And really, if we had a much more sophisticated back-end system, like enterprise resource system, coupled and integrated with a front-end system, I could just have a robotic process automation to run estimates on the bill and say, based on your son's demographic and condition, and you're seeing this particular doctor who's charging X amount, your bill within a 95% confidence interval is going to be this. And they have done this in Singapore, where you have, national health insurance, because capitation is very important. And I think that that's where we're heading in Malaysia to make it sustainable. And telehealth is just one of the ways in which it will help us tremendously to get that data, to get those systems in place so that we can deliver this value to our customers.
Excellent. Oh, very good.
And Karamjit, just to add to that, like having a marketplace for both the providers and the pharmacies or even the lab members, right, will allow the more options for the patients, right? You can decide whether you want to buy a medication or visit a doctor and get it lab done beyond your usual comforts of going to the same clinics and same hospital in your taman, or that's covered by your panel hospitals, right? Because many of the conditions are out of pocket, and it really matters. But the lack of price transparency, it's a clear barrier for allowing the patient's options as well as allowing the industry to support or to actually allow the winners or the best performing guys to flourish. And having this digital enabler is a key tenet to actually allowing for affordable healthcare to be provided.
Interesting, man. It's all happening right now, man. And I hope for all of you listening, this discussion has been interesting, or maybe left you wanting more. And then I'm sure there'll be plenty more discussions out there, on the internet about this very relevant and very important topic. Thank both of you panelists for sharing your insight. And Prem, I'll pass it over to you for closing remarks.
Okay, thanks so much. Thanks, Maran. Thanks, Nadiah. I really enjoyed the conversation. I learned a lot more about telehealth. Definitely just looking from the outside, I now have a much more detailed insight about how the industry is going, what's ahead. And definitely, we're kind of like so old school, like always used to going to the clinic and doing things in a normal way. So it's kind of a mindset change for all of us. And I'm very glad that, Malaysia is ahead of the curve, and we're doing so much to introduce these new types of medical assistance. So thanks so much for joining us today. I hope the audience enjoyed it. I'm sure they have. Please email and get in touch with any more questions you have around telehealth, and I'll see you soon for the next Top in Tech. And thanks so much to Karamjit and Digital News Asia, Scale Up Malaysia, KiniEvents, Malaysia Kini, all our partners that brought us telehealth today. Thank you so much.